As a doctorate in cancer care, you would think that I would be the best cancer patient ever. But it's actually the opposite. When I was diagnosed with cancer, everyone told me to stop eating soy. As a cancer survivor, don't eat soy. Ever. Why? Because it will make your cancer grow. But I didn't listen. I eat soy and phytoestrogens all the time. In this video, I'm sharing with you exactly why you should do the same. So why does everyone try to scare cancer survivors into completely avoiding soy? If you have heard the same or been told this, you are so not alone, especially breast cancer survivors. So many of the women that I work with are completely terrified to eat soy. You want to do absolutely everything you can to reduce your risk of your cancer from coming back. Unfortunately, all too often, someone passes along some outdated information and you start making drastic cuts to your food. Cutting out foods that are truthfully very healthy, and even if you do cut them out, it's going to make zero difference as to whether your cancer comes back or not. But first, let's talk about how this rumor actually started. Why did people start thinking that soy was actually going to fuel cancer? In the past, there was a theory that soy would act like estrogen in your body. Soy is often referred to as a phytoestrogen. It has a similar chemical structure, but not the same, to the estrogen that is circulating in your body. Similar, but different. The idea at the time was that if you ate soy, it would increase your hormone levels. Because it's acting similar to estrogen in your body, if you ate soy, it would increase your hormone levels and fuel your cancer. Some people will even go as far as to tell completely healthy women who have never had cancer before to avoid soy because of its phytoestrogen properties. But also for cancer survivors, there was a thought that if you ate soy in hormone-positive cancer, so ER/PR positive breast cancer, for example, that the soy would actually increase your risk of a cancer recurrence. This theory was that the phytoestrogen properties of soy would actually cause your cancer to grow. What ended up happening was a lot of clinicians ended up telling their patients to completely avoid soy. They did this out of an abundance of caution. The result was that many cancer survivors were told to never eat soy again. And it was actually more than just soy. It was all phytoestrogen. Foods like flaxseed, sesame seed, edamame beans. So much food fear was born out of this statement. A statement that didn't even turn out to be true. It's completely ridiculous that soy will fuel cancer, and here's why. This theory about soy and cancer was just someone's hypothesis. It was never actually proven. This means that some scientist was just sitting around thinking about soy and its chemical structure, and they thought, I bet this will raise women's hormone levels if they eat it, and that will cause problems. So then they shouldn't eat it at all, period. But just because someone has a thought that something might happen, that doesn't make it true. And that is exactly what has been proven right now. Here is what you absolutely need to know about soy and cancer risk. Over the last 6 years, there has been an abundance of clinical studies that have totally and completely disproven this theory. The most impressive study was published in JAMA in 2009. This study looked at over 5,000 breast cancer survivors and followed them for about 4 years. They found that eating soy significantly reduced the risk of a breast cancer recurrence and death. So breast cancer survivors that actually ate more soy were less likely to have a breast cancer recurrence and less likely to die. Okay, let's back up here. We have gone from soy is dangerous and cancer survivors should never eat it to soy can actually prevent your cancer from coming back. Yes, it is actually true. Soy can help prevent your cancer from coming back, and it's been proven over and over again. Like this meta-analysis from 2020. This study actually summarized the results from 12 different independent studies and found that if you eat soy, your risk of a breast cancer recurrence is actually lower. Okay, so you should be starting to feel a little safer about eating soy by now. But if you have hormone-positive breast cancer, you might be wondering, well, what about me? Is it safe for me? Is soy safe in hormone-positive breast cancer? We also now know that eating soy will have a different impact on your body depending on your tumor type. So eating soy will have a different effect if you're hormone positive or if you're HER2 positive. But the most benefit from eating soy can actually be found in hormone-positive breast cancer survivors. So if you have ER/PR positive breast cancer, then eating soy is not only safe for you, but eating soy will actually reduce your risk of a breast cancer recurrence. The same can actually go for BRCA carriers. Eating more soy as a BRCA carrier can actually reduce your risk of a cancer recurrence. Now, the least benefit is actually seen in HER2 positive breast cancer survivors. Now, if you're HER2 positive, you still get benefits from eating soy, like a lower risk of recurrence and lowering your risk of death. But the benefit is just to a lesser extent than other tumor types. Okay, so we've gone from never eating soy again to be sure to eat it all the time. But wait, is there actually such a thing as eating too much soy? Do you need to stick to a certain level of soy to be safe and to reduce your risk of recurrence? To answer this, we look at populations that eat large amounts of soy in their diet, such as Chinese breast cancer survivors. Here, we're able to take a look at how eating high amounts of soy actually impacts your cancer recovery. When moderate levels of soy are compared to high levels of soy consumption, we actually see that both are quite safe. There's actually no upper limit as to how much soy you can eat. So this means you actually don't have to worry about minimizing your soy consumption in any way. But what we do see is eating high amounts of soy has actually been proven to further reduce your risk of a cancer recurrence. So in this case, with soy, more is actually better. So being a bad cancer patient actually really worked out for me. I went from stage 3 ovarian cancer to 6 years cancer-free. Now, I wanna show you exactly how to be a bad cancer patient and stay cancer-free. I've linked up this next video right here to get you started, so I'll see you in there.